Hi, I'm Jenny, and I'm a local realtor, and this is my husband Harry, and we love Dr. Shane. This is where we bring our babies, so we're featuring her today.
Hello, I'm Dr. Karen Shane. Welcome. We're at Shane Veterinary Medical Center today, and I'm happy to have you here.
I met her about 4 years ago when our little puppy had a really bad urinary tract infection, and we had just moved into the area, and it was an emergency meeting, and came in, and you were so magic with him and took care of our feelings as much as our dog. So yeah, thank you for spending time with us, and we wanted to show the world what you do and who you are and how special your business is and how great it's been for us. And so yes, wanted to hear, like, how did you get started as a vet initially? So what was that passion for you?
I was actually 26. I was a certified public accountant before I became a veterinarian, and I was living in New York and working in Manhattan and commuting from Long Island, and I had a pet bunny rabbit, a 2-pound bunny rabbit, Kiwi, that got very sick at 2 years of age, and no veterinarian could cure him, and he unfortunately died. And so it kind of shook my world up and turned it around, and I decided to switch careers, go back to school, which I initially thought was probably going to be about 2 or 3 years. It turns out 9 years later. Moved halfway across the country to Kansas, went to veterinary school, and then moved out here for my internship, and have been out here ever since.
How did you choose Marina del Rey?
Marina del Rey, I conducted significant demographic studies, and I really like the area. I like that it's kind of a beach city, and there are a lot of vertical high-rises, so a lot of dense population in a small area. It's a very dog-friendly neighborhood, and there weren't too many veterinarians here at the time. There were only other 2 hospitals, so that helped kind of guide me into this direction. So
you're kind of a revolutionary in the veterinarian world. I mean, like you come to Marina del Rey, you open on a Sunday, that's so cool.
Yeah, it's been great. I have an amazing team, and everyone loves animals, and we all love what we do, so it makes coming to work fun.
So one of the things I've always wondered about is being a vet is the lack of communication you can have with your patient. Mm-hmm. So being that medicine and being a doctor is a science field, how much of your diagnosis is based in science versus intuition?
I think that has evolved over the 18 years that I've been in practice. Initially, it is science-based because that's how you're trained. And so you're following everything by the book. And it's pretty easy once you know your medicine. And then once you get to know and learn your patients and really sink your teeth into veterinary medicine, then your intuition starts to awaken, so to speak. And now I'd say it's a combination of both.
And were there practices or studies that you did outside of what would normally be the medical umbrella of your profession that you did that helped with that?
I am a certified veterinary acupuncturist, and I practice acupuncture, veterinary acupuncture, and Chinese medicine. Wow. And I'm also trained in Reiki. So yes, I feel like that those have definitely aided in my approach, and I practice an integrative approach to veterinary medicine. So a combination of conventional therapy and then also Chinese medicine and acupuncture and Reiki when relevant.
How does that work, like acupuncture on the dogs? Like, how have you seen that, do they really respond to that?
I feel like they respond almost better than people do because they don't have any preconceived notions, and they really respond well. So if it's an acute condition, you can see a change within one treatment. If it's something that's chronic, like arthritis or cancer, it takes a little bit longer before you see a response, a few treatments, but they all really respond well. So.
Okay, so I have a 12-year-old daughter. She loves, passionate about animals probably as much as you are. And it's interesting because she can't watch any movies that have animals in it, even if they're happy movies, because there always seems to be like a moment where the dog's in danger and she starts bawling, crying.
Sure.
And she'd be like, "Dad, I'm not watching the movie." Which brings then the question of like, how do you, and she wants to be a vet, and but like, how do you balance those emotions of the heart?
Sure.
With I know you're healing, but you can't heal everyone.
Exactly, and that's a really good question, and it's challenging. With those emotions of the heart, I feel like there are definitely sad times in veterinary medicine, of course, but the good times and the amount that you can heal and perform a good service and make owners like yourselves feel happy especially when they're in the middle of a tragic event, really just, it makes me feel so enlightened, and that's what keeps me going and allows for those scary or not so happy times. That helps mitigate it.
So what would you recommend to yourself as a young teenage girl wanting to get into a veterinary profession? How would you recommend, or what direction would you give?
I would recommend having her, when she's of age, start working in an animal hospital and seeing if that feels like a good fit for her. And I feel like she'll be able to know. And she's so young that she may change her mind 100 times, or sometimes children just know, like right from the beginning, this is exactly what I want. So that's what I would recommend doing, just getting your feet wet and living it and learning it, and see if that's something that you like, and she'll know.
Do you have any volunteers? Do you ever let people volunteer here?
We do. Before COVID, we did. With COVID, it's a little more difficult now, but yeah, absolutely. We can definitely talk to you guys about that.
Oh, that'd be great. Yeah, she would love that. And what are you most proud of with your business?
The fact that my clients love me.
And then you win Best Vet year after year?
We do, yeah, we do.
Yes, you do.
We do, and we try our best, and I'm fortunate that I have my husband that manages the place, so I get to come in and practice medicine, and I have the fun job.
Wow, so you work with your husband?
Well, we're shifts in the night, so when I'm here, he's home watching the kids, and then when I go home, he comes back into work, and he'll come home at 1 in the morning.
Wow, so did you guys start together, or did that kind of like morph over time?
It evolved over time.
Okay.
Yeah, it evolved over time and became kind of like he started helping and then realized how big of a job it was, and then he just undertook that job, thankfully.
Yeah, what a blessing.
Yes.
Well, I want to say thank you. Thank you for taking care of Yoshi and all of our little four-legged kids.
Oh, they're adorable.
You've been amazing, and thank you so much for your time.
Of course, of course. Thank you guys for coming.
Thank you so much.
You're welcome.